Welcome to the Health Secrets and Food Cures channel. Today's video is on DHEA. Please, YouTube viewers, be aware that this video is for informational purposes only and is not intended as medical advice, nor is it intended as a diagnosis to any medical condition. Links to where you can buy your own DHEA are located in the description box below. Thank you. Let's begin. Dehydroepiandrosterone is a hormone made by the adrenal glands located just above the kidneys. Scientists have known about it since 1934, but it became available to the public without a prescription in 1995. Shortly thereafter, pregnenolone became available. More than 150 hormones are made by the adrenal glands. However, the most abundant is DHEA. Humans are thought to make between 10 and 15 milligrams a day. These numbers are lower in women by about 10 to 20%. After it is made by these glands, it goes into the bloodstream, and from then on it travels all over the body and goes into our cells, where it is converted into male hormones, known as androgens, and female hormones, known as estrogens. Small amounts are also made in the brain by neurons, brain cells. Many doctors prescribe this hormone supplement to their patients in high dosages without realizing the risks and dangers it can cause. DHEA supplements are used by some people who believe they can improve sex drive, build muscle, fight the effects of aging, and improve some health conditions. There is not much evidence for many of these claims. And the supplements have some risks. Here's a rundown of what science actually knows about DHEA supplements and what you need to know about their safety. DHEA supplements can be made from wild yam or soy. Scientists don't know everything DHEA does. But they do know that it functions as a precursor to male and female sex hormones, including testosterone and estrogen. Precursors are substances that are converted by the body into a hormone. DHEA production peaks in your mid-20s. In most people, production gradually declines with age. Testosterone and estrogen production also generally declines with age. DHEA supplements can increase the level of these hormones. That's why a number of claims have been made about their potential health benefits. Those claims range from benefits such as building up the adrenal gland, strengthening the immune system, slowing natural changes in the body that come with age, providing more energy, improving mood and memory, and building up bone and muscle strength. Since DHEA levels decline with age, some researchers speculate that supplementing your body's falling levels of the hormone might help fight aging. And some small studies have reported positive anti-aging effects from the use of DHEA supplements. But a similar number of studies have reported no effect. There is not enough scientific evidence to support the idea that DHEA can affect how fast you age. Little is known about the effect of long-term use of DHEA. There is some concern that continued use of DHEA supplements could be harmful. DHEA supplements show some promise for easing mild to moderate depression. More research is needed. In a small, 6-week study, it was discovered that DHEA supplements helped relieve mild to moderate depression that occurs in some middle-aged people. DHEA may also be effective for improving aging skin in the elderly. Evidence is unclear whether DHEA has any significant benefit in treating conditions such as low bone density, heart disease, cervical cancer, systemic exertion intolerance disease, SIDS, formerly known as chronic fatigue syndrome, Crohn's disease, infertility, rheumatoid arthritis, schizophrenia, sexual dysfunction. DHEA may not be effective for treating psoriasis, fibromyalgia, rheumatoid arthritis, dry mouth, or mental decline. The possible side effects of DHEA supplements can include oily skin and acne and pimples, as well as skin thickening. Acne can occur due to increased levels of androgens. There are those who are very prone to acne eruptions, and they could have pimples develop within a day or two. There are others who have taken this androgen hormone for months and years without any skin problems. Any androgenic steroid, such as DHEA, testosterone, and androstenedione, can cause the side effect of hair loss or thinning in susceptible individuals. DHEA is likely to raise levels of testosterone and dihydrotestosterone, DHT, in the hair follicles. Too much DHT will lead to hair loss. The temporary, 2 to 3 month, use of finasteride Propecia 1 mg or Proscar 5 mg could stop the hair loss and possibly regrow part or all of the loss. It is difficult to predict how long a person would need to take finasteride. Even if DHEA supplementation does not significantly increase levels of testosterone in the bloodstream, it is still quite possible, and perhaps likely, that it enters hair follicles, and is converted to testosterone, and on to DHT locally, thus contributing to hair loss. The study of hormones is called endocrinology, and there is increasing attention to the study of hormones inside tissues and cells. This is called endocrinology. More side effects can include stomach upset, high blood pressure, changes in menstrual cycle, facial hair in women, deepening of the voice in women, fatigue, nasal congestion, headache, rapid or irregular heartbeat, insomnia, unfavorable changes in cholesterol levels. Some of these side effects can result from DHEA raising the level of testosterone and estrogen in a person's body. Little is known about the long-term effect of the elevated hormone levels. DHEA supplements should not be taken long-term without consulting with a healthcare professional. A version of DHEA supplement known as 7-keto has been widely promoted as an aid for reducing body fat and raising metabolism. The idea is that leaner body tissue and higher metabolism will burn calories more efficiently, making it easier to not only lose weight but also keep it off. Unfortunately, most of the studies that have been done have shown little effect from DHEA in losing weight or increasing metabolism. It's a good idea to talk with your doctor or a nutritionist before investing in a DHEA supplement for weight loss. DHEA supplements are sometimes used by athletes because of a claim that it can improve muscle strength and enhance athletic performance. That's because DHEA is a prohormone, a substance that can increase the level of steroid hormones such as testosterone. There is little evidence to show that DHEA has any effect on enhancing muscle strength. There are risks associated with using any pre-steroid enhancer. The higher the dose, the greater the risk. Possible side effects include permanent stunting of growth, aggressive behavior, known as roid rage, mood swings and other psychological symptoms, higher blood pressure, liver problems, changes in cholesterol levels. Since DHEA can increase the level of both testosterone and estrogen, women who use DHEA can sometimes experience such permanent side effects as voice changes, hair loss, growth of facial hair. Men can sometimes experience such symptoms as breast enlargement, shrunken testicles and reduced sperm production. If you are thinking of using DHEA supplements, there are several reasons you should discuss doing so with your doctor first. Many of the claims for DHEA involve serious medical conditions. These conditions need to be evaluated and treated by a healthcare professional. DHEA can interact with some medications and could alter their effectiveness. Because DHEA can raise the level of both male and female hormones, the supplements can have a negative effect on hormone-sensitive cancers. High dosing for prolonged periods, many years, could theoretically increase the risk for certain cancers such as breast cancer and prostate cancer. It is well known that excess exposure to many types of hormones, such as androgens, progesterone, and estrogens, increases the risk for certain types of cancer. Use of DHEA carries some risk and can cause a range of side effects, though this usually just occurs at the higher end of the dose range. Blood and saliva testing are not reliable ways to determine how much DHEA you should take because blood levels do not give a clear view on how this hormone is interacting within cells in the brain, skin, hair, liver, breast, prostate, and other tissues and organs. You may consider other non-hormonal options to improve your health. For instance, for sexual health and libido improvement, consider a popular and effective male and female herbal sexual enhancement products such as Dhea. For mental health, there are various brain supplements. To improve muscle tissue, consider creatine powder. For more energy and a sense of well-being, try the natural antidepressants 5-HTP, St. John's wort or SAMe. If there are no other good options, and if you really do need to take a DHEA supplement, use the smallest amount that works in order to prevent unpleasant reactions. Take frequent breaks, which we call hormone holidays. This concludes the Health Secrets and Food Cures video on DHEA. Links to where you can buy your own DHEA are available in the description box below. Thank you for visiting the Health Secrets and Food Cures channel. And, please subscribe.